Today we'll discuss a real-life medical scenario involving a 58-year-old man who suddenly developed shortness of breath and chest pain just 36 hours after a left total knee replacement. He was recovering well, even walking with assistance the day before. But this morning, while heading to the bathroom, he experienced sharp chest pain and difficulty breathing. Let's walk through his symptoms, exam findings, and test results to uncover the most likely diagnosis. Patient is a 58-year-old man with a history of hypertension and obesity with a BMI of 34. He underwent a left total knee arthroplasty and was recovering on the surgical ward. His medications include lisinopril for blood pressure and enoxaparin, a blood thinner, started after surgery. These details are important, as they set the stage for understanding his risk factors and the events that followed. The patient's symptoms began suddenly while he was walking to the bathroom. He developed sharp chest pain and shortness of breath. Sudden onset of these symptoms, especially after surgery, is a red flag for serious complications. The timing and nature of his symptoms are crucial clues in narrowing down the possible causes. Examination: his vital signs were concerning. Heart rate was elevated at 118 beats per minute, blood pressure was slightly low at 108/72, respiratory rate was high at 26 breaths per minute, and his oxygen saturation was only 88% on room air. He was afebrile, meaning he did not have a fever. These findings suggest that his body is under significant stress and struggling to get enough oxygen. Physically, the patient appeared anxious but did not have jugular venous distension, which can be a sign of heart failure. His lungs were clear on both sides, ruling out pneumonia or fluid overload. However, his left calf was mildly swollen and tender to touch. This localized swelling is a key finding and may point toward a problem with blood flow in his leg. In cardiac examination, his heart was beating fast but regularly with no murmurs or abnormal sounds. This finding, combined with his other symptoms, helps us focus on certain diagnoses and rule out others, such as heart valve problems or pericarditis. The absence of a murmur or rub is significant in narrowing down the cause of his distress. His ECG showed sinus tachycardia, which means his heart is beating fast but in a regular rhythm. Importantly, it also revealed an S1Q3T3 pattern. This specific pattern is a classic sign seen in certain heart and lung conditions, especially when there is a sudden blockage in the arteries of the lungs. This clue is critical for our diagnosis. A chest X-ray was performed and came back normal. This is important because it helps rule out other causes of chest pain and shortness of breath, such as pneumonia, collapsed lung, or heart failure. A normal chest X-ray in this context makes certain diagnoses more likely and others less so. Lab tests showed a mildly elevated troponin at 0.12 ng/ml, which can indicate some strain on the heart. BNP was 120 pg/ml, a value that is not particularly high but may reflect some cardiac stress. D-dimer, a test for blood clots, was still pending. These results add more pieces to our diagnostic puzzle. When the patient stood up, his blood pressure dropped further to 86/54, a phenomenon known as postural or orthostatic hypotension. This suggests that his heart and blood vessels are struggling to maintain adequate blood flow, possibly due to a sudden blockage or strain on the heart. Let's review his risk factors. Recent major surgery, obesity, and limited mobility all increase the risk of blood clots forming in the legs. Even though he was on enoxaparin, a blood thinner, no medication is 100% effective. These factors make a clot-related complication much more likely. The swollen, tender left calf is a classic sign of deep vein thrombosis, or DVT. This condition occurs when a blood clot forms in the deep veins of the leg, often after surgery or periods of immobility. DVT is a serious condition because the clot can break off and travel to the lungs. When a blood clot from the leg travels to the lungs, it causes a pulmonary embolism, or PE. This is a life-threatening emergency that blocks blood flow in the lungs, leading to sudden shortness of breath, chest pain, low oxygen levels, and sometimes shock. The ECG findings, low oxygen, and sudden symptoms all point toward this diagnosis. Putting all the clues together: recent surgery, obesity, sudden chest pain and dyspnea, swollen calf, ECG changes, and low oxygen, the most likely diagnosis is an acute pulmonary embolism. This condition requires immediate medical attention and can be fatal if not treated promptly. This case highlights the importance of recognizing the signs of pulmonary embolism, especially in patients with recent surgery and risk factors like obesity and immobility. Early recognition and treatment can save lives. Always consider PE in patients with sudden shortness of breath, chest pain, and risk factors for blood clots.